Myths about death, debunking 3 mysteries of dying. In the last 100 years or so, since the modernization and advancement in healthcare and the hospital system, death has been largely removed from the home and now occurs primarily in nursing facilities, such as nursing homes or hospital systems as well. Because of this, death and dying has at large been seen as this taboo topic that many people now fear. As hospice and palliative care and other end-of-life care professionals like end-of-life doulas and non-medical practitioners continue to educate the public and the healthcare system about natural dying and natural death care, we are seeing more and more death taking place in the comfort of people's own homes. Unfortunately, though, due to the media and a lack of education across the globe, there are still these perceived myths and mysteries about death and dying that are largely misunderstood. Hi, it's Katie Duncan here with Death Care Coach. I'm a nurse practitioner and an end-of-life coach, and I'm here to help you prepare for the dying process and end-of-life journey. In this video, let's debunk 3 myths about death and dying. Myth number 1. There is this belief that dying is always painful. And this is a very common misconception that dying equals pain. This is a big myth. Research shows that while dying can involve discomfort or distress, it is not necessarily painful. And with proper care, many of those physical symptoms at the end of life can be effectively managed. Let's debunk this myth a little bit more. Here is an important distinction that dying does not inherently equal pain. Dying is not inherently painful. It is disease and the complications and manifestations of that disease or diseases that can cause pain. While pain can be a symptom in certain terminal diseases and conditions, the process of dying itself does not necessarily include physical pain. Many people experience a gradual decline where the body naturally shuts down, often without significant pain at all. I think people are probably going to ask, okay, well, how do you know? How do you know this? Well, from experience, experiential evidence. From my experience, more often than not, people who are dying, and they are also able, by the way, to communicate verbally and even non-verbally, even in the hours to days before death, many of my clients, in fact, the majority of my clients and my patients that I've worked with have told me that they are comfortable, that they are not experiencing pain, and they're able to communicate that verbally. And for those people who are not able to communicate anymore verbally, they are showing us that they are okay by their non-verbal cues. They're showing us they're comfortable through their body language. We know that in a lot of cases, non-verbal cues and communication, it is actually a better way of communicating. And non-verbally, their facial expression is relaxed. Their bodies are relaxed. They're laying still and they appear very calm and peaceful. These non-verbal cues are indicating, I'm okay, I'm comfortable. So really it is disease and the complications and manifestations of that disease or diseases that cause pain, not the dying process itself. Now, dying can involve symptoms like fatigue and weakness. It could involve shortness of breath or changes in consciousness. These symptoms are part of the body's normal and natural shutting down process, but they don't equate to pain. They don't equal pain. And any discomfort from these symptoms or any pain symptoms from the person's disease process can be treated and relieved with proper pain medications and non-medication techniques and care. For example, medications such as morphine or even lorazepam may help ease things like pain and breathlessness, restlessness, and really help people feel more at ease. Much of the fear surrounding death stems from the anticipation of pain rather than the actual experience of pain. Research has shown that while many people are afraid of pain at the end of life, those receiving hospice care report feeling relief and comfort, particularly when proper symptom management is in place. I will add on one piece here that I think is important to also think about and consider, and that is emotional and spiritual distress. Emotional and spiritual or psychological distress can play a more significant role at the end of life than physical pain itself. Feelings of fear and anxiety, sadness, or any unresolved emotional issues can sometimes make the process more difficult for the dying person and their family as well. And that emotional or spiritual or psychological distress can sometimes manifest as physical pain. And that's why it's so important to give people space to talk about the emotional experience, their feelings that they are having as they're going through this journey. We've got to address that. Hospice care and death doulas or end-of-life coaches can focus on these aspects by providing that emotional support, counseling, and spiritual care to address the holistic experience of the dying person. Studies back up my personal experience, where I have found that most people experience a peaceful and calm death when they are receiving appropriate medical and emotional support at the end of life. So that is myth number one. Dying does not equate to pain. Dying doesn't equal pain. Myth number two. Families often believe that their loved one is dying because their loved one is starving, or because they stop eating, or because they are dehydrated and stop drinking. There is this big fear, and families are always asking, well, should we use IV fluids, or shouldn't we use a feeding tube and start artificial nutrition? Here is the truth, and a very important distinction to make that can be hard to hear, and that is this, that the dying person isn't dying of starvation or because they're not eating. The dying person isn't eating because they are dying. And similarly, the dying person isn't dying because they are dehydrated. The dying person isn't drinking because they are dying. That is a huge misunderstanding. Again, we have to go back to this, that the body knows exactly what to do. The body is not trying to survive at this point. That's not the goal right now for a dying person's body. The goal is for all of the body's systems to shut down. And the body knows exactly how to do this. And in so many ways, the body is organically, naturally cueing that person. It stops sending out those hunger and thirst sensations. They stop feeling hungry, they stop feeling thirsty, and they also lose the ability to swallow. If the dying person is hungry or they are thirsty, that's great, that's fine. And if they want something to eat, great. Or to drink, okay. But more often than not, they usually don't. A lot of people will say that they feel nauseous. So for example, you know when you're sick and you really just have no appeal for food. Food is not appealing. You don't even want to think about food. That is oftentimes how a dying person will explain it. They just don't want anything to eat or drink. It doesn't appeal to them. Sometimes food and fluid does make them throw up. It might make them bloated, they're gassy, they get reflux, and in the worst situations, they might actually aspirate. That is when contents from the stomach or the mouth or the throat will end up getting into the lungs, and it can cause things like pneumonia, and it can also cause immediate breathing distress, and oftentimes a person will die very soon after that. When a person's body and the systems in the body are shutting down in preparation for death, the systems don't know how to handle things like food or fluid because those systems aren't working anymore. The heart isn't working as well anymore. The kidneys aren't working as well anymore. The systems are shutting down. Those systems are going to reject anything we try to push inside of it. IV fluids and artificial nutrition through a tube are not going to prolong someone's life or make them more comfortable. Instead, studies show they can actually end up causing more distress to the dying person by causing things like swelling or bloating or reflux, nausea, vomiting. Fluid can end up in the lungs and increase that risk for aspiration and increase that risk for breathing distress and discomfort. It is basically putting the body systems in overload. Remember, our bodies knew exactly what to do to come into this world. We knew exactly what to do, and they know exactly what to do to leave this world as well. The best thing we can do is to honor our person's body on its natural dying process and on its natural journey. That is myth number 2. The dying person isn't dying because they're not eating or drinking. The person is dying, and that is why they aren't eating and drinking. Finally, myth number 3. There is this myth that the rattling or gurgling noise that we hear a dying person make when they are near death is painful, or that they must be drowning, or that it stops them from breathing altogether. To say this right off the bat, the death rattle is not painful. The person is not drowning, and it's not stopping them from breathing. The death rattle is also known as terminal secretions. Terminal secretions is a natural and normal part of the dying process. At this time of the dying process, when the dying person is actively dying, they have lost the ability to swallow. They are also most likely in an unconscious state, and the body is going to continue to make what are called secretions. Secretions, I want you to think just wet stuff in the body. So saliva in the mouth, mucus in the nose. We have secretions all throughout our body for many different reasons. Even when this person is in an unconscious state and they've lost the ability to swallow, and the body is going to continue to make these secretions, so think like saliva, for example, eventually what happens is that the saliva, that those secretions, they end up collecting in the back of the throat as it continues to be made, and that person can't swallow. And every time that person takes a breath, air coming in, air going out, that air passes over that collection of secretions and saliva, and it creates this wet noise, this gurgling, rattling type of noise. And this is completely normal. It is a normal part of the dying process. But for families who aren't expecting this and who don't really know what this is, they are oftentimes very worried because it can sound really disturbing if you don't know that this is expected and that this is normal. Families worry that their loved one is in pain or that they're suffering, or they worry they might be drowning. A couple of things here. Researchers believe, and those of us in the end-of-life field believe, that the dying person is not in pain, that the death rattle, these terminal secretions, are not causing any sort of suffering, and it's not really bothering the dying person. The reason this is believed is because when we look at the full picture, when we look at the dying person and their body language, their nonverbal cues, generally speaking, in most cases, the person is going to continue to seem calm. They're relaxed. They're laying in bed. Their face is relaxed. Their body's relaxed. Their nonverbal communication is telling us, this isn't bothering me. This is fine. And so that is how we know that this is not painful or causing any sort of distress or suffering. And drowning is different. Drowning is fluid in the lungs. These secretions, think like saliva, are collecting in the back of the throat because the person has lost the ability to swallow, and it's really just air passing over that collection of secretions that creates this wet sound, this wet noise. That is myth number 3, that the death rattle is not painful, the person isn't drowning, and it's not causing suffering. Those are 3 big myths about death and dying. I hope this information has helped you understand or prepare a little more for what to expect at the end of life. Thank you so much for watching. If you have any questions, please do not hesitate to leave a comment below. I will do my best to create more videos that answer your questions. If you'd like to hear more from me, please consider liking and subscribing to my channel. I share more about death and dying and hospice, end-of-life care, death doulas, grief, and so much more. Thanks so much, and see you next time.